Hello, this is Dr. Zara. Hope you all are fine and preparing well for your OET speaking exam. So, today we will discuss card number 2. You can see two cards in your screen, role player card and the candidate card. And we discussed in last class as well that you will get only the candidate card, but to know more about this exam and uh, the expected question the role player can ask you, so you can read for your preparation both card and accordingly you can prepare. Okay, so here you can see role player card number 2, the first card, setting a suburban clinic and you are a patient. This is the role player card. Okay, so whoever communicating with you is the role player, and this is the task role player should have to fulfilled. Okay, and this role player card will be not visible to you, only the candidate card they will give you. Okay, let's start. So you are a patient, you are a 42-year-old, and your doctor has just provided you with the results of your most recent fasting blood glucose test, 7.6 milliwolt. The test is your second test this month, and the results confirms the diagnosis of diabetes mellitus type 2. You have a limited understanding of diabetes mellitus, which you know by the term sugar diabetes. You are not convinced of the diagnosis of diabetes mellitus on the basis of merely two test results. You challenge the diagnosis. And what are the tasks given to the role player? Seek clarification of the diabetes mellitus. Ask, I have heard of diabetes. Is that the same as sugar diabetes? Stress that you are not convinced of the diagnosis. Comment, could that be right? I don't eat sugar or anything. You only did the two tests. Can you be sure? The third task is explain that because you don't believe the diagnosis, you are reluctant to commence the doctor's suggested management plan for controlling your blood sugar levels. Demand more tests, reluctantly agree with the doctor. Okay, this is for the role player card, and this is the task for the role player. Okay, let's read the candidate card. Of course, when you will get your card, you will get 3 minutes to read that card, and in that 3 minutes, you have to first ask three questions to you, that where exactly you are. So where exactly you are, you can know by the setting. So setting is suburban clinic. That's mean you are at the suburban clinic. It could be emergency hospital, it could be hospital ward, and so you have to have know that what exactly the setting is and who you are. The second question is who you are. You are a doctor. And third is to whom you are speaking. You are speaking to a patient. Okay, so you are a doctor and you inform your 42-year-old patient of his or her recent fasting blood glucose test results, 7.6, which confirms the diagnosis of type 2 diabetes mellitus. The test is the patient's second test this month. The patient challenges your diagnosis. So here are three things you should noted during your your reading time. That patient is 42-year-old, and she came to know more about her results of fasting blood glucose test, which you know that it's confirmed a diagnosis of type 2 diabetes mellitus. And because confirmation uh, is because that she did the second time this test, and the patient is now not agreeing with this diagnosis. So of course you have to communicate on that part. Okay, now follow your task, and during a speaking one by one you have to complete your task. So first you can see that you have to briefly explain the diabetes and its causes. Emphasize that you can get sugar diabetes even if you don't eat sugar. So this you should have to more focus on that. Even if the might be patient will, of course, in the task you can see that role player card task, that they will tell you that I don't eat sugar or anything. So can you be sure with that to test? So more focus you have to pay here on this task about that you are emphasize that you can get sugar diabetes even if you don't eat sugar. Okay, Then explain that the threshold raised glucose value on two occasions for diagnosing diabetes mellitus are determined by WHO standard using evidence from the research. Explain that early treatment and regular appointment for monitoring diabetes status, example sugar, blood pressure, cholesterol, will help prevent complications such as blockage of the blood vessels to heart, brain, and feet, problem with the kidney and eyes. Recommend dietary lifestyle changes and refer to dietitian, diabetes educator. Convince the patient to commence preventive measure as the test results are valid and further tests are unnecessary. So there are 5 tasks you can see in your screen, and you have to follow all the tasks one by one. Okay, so let's start. What are the lines doctor should have to speak, and what are the lines which patient can speak with you, role player can speak with you? So always start your speaking task by yourself. Don't wait for the role player or patient to start with. All right, so you have to greet, introduce yourself, and then you have to start your conversation. So let's start and reading this line. Doctor, this is the doctor's line, and wherever the doctor is written, so these are the doctor line, and these are your lines, okay? And the patient means the role player line, okay? So what are the doctor line in the starting you should have to do? So good morning. I am Dr. Khwaja. I have received your recent fasting blood glucose test result, and I would like to discuss them with you. What has been on your mind regarding your health lately? So patient will give you the answer, or role player will give you the answer. I'm not feeling great, to be honest. I'm a bit worried about what the results might say. And what are the doctor's line? I hear that it is completely understandable to feel anxious while waiting for results. I truly appreciate you being open with me about those concerns. Now give some pause and then start, okay? Looking at your report, the glucose level is 7.6 millimole. Since this is the second test this month showing this level, it does confirm a diagnosis of type 2 diabetes mellitus. Okay? Then again, you have to give some pause because you know that patient is not agreeing with the test results. So you know with your task that patient can ask you some question about this. So give pause so patient can ask you a question. Okay, give some time to the role player as well. Don't speak, and don't speak for a long time. Don't speak for 1 or 2 minutes, and it's important to give some pauses in between so patient can ask you some question. So it is very important to give pause, and in that pause, patient surely will ask you and fulfill their task. So give some time to fulfill their task as well. So patient will tell you that, or role player will tell you that, I have heard of diabetes. Is that same as a sugar diabetes? Here you can see that she is now asking you the first task, that is that the same as a sugar diabetes. So what should be your line? That is a very valid question. Yes, it is often referred to as a sugar diabetes. I can see that this is unexpected for you, especially given your concerns about your diet. Even if you don't eat sugar, the body can still struggle with insulin, which lead to these elevated level. Tell me what kind of diabetes have Tell me what kind of diet have you been following lately? Hmm? So, uh, give the pause again, and then they will tell you that I mostly eat home cooked meal, and I really avoid sugar snacks and soft drinks. That's why I find this so hard to believe this results. So then what should be your line? I appreciate you sharing with me. It's clear you have been trying to make healthy choices. Even with a careful diet, factors like genetics or how your body metabolizes energy play a huge role. I can see why this feels like a setback despite your efforts. So here you are showing empathy and validation, and then again the patient can tell you, could that be right? I don't eat sugar or anything. You only did two tests. Can you be sure? Then doctor gives you, or this is should be your line. I hear how hesitant you are, and I truly understand. This is showing the understanding. This is showing that you are showing empathy and sympathy to the patient. That I truly understand why you feel uncertain about the diagnosis based on two sets. However, I would like to explain the clinical reasoning here. Okay, here you are giving the signposting before discussing that clinical reasoning. That now you are going to discuss the clinical reasoning. So before that, you are giving the lines that I would like to explain the clinical reasoning here. This is the signposting, and then you can start. The threshold for diagnosing diabetes are set by WHO based on extensive research, and two race reading are considered definitive in our medical standard for the diagnosis. Patient can tell you that because this is their task to tell you that I'm still not convinced, so I'm really reluctant to start any management plan. Can't you do more tests? And then you can use this line. I acknowledge your desire for further testing, but my main priority is to prevent long-term complication, and if we delay, we risk issues such as damage to your eyes, kidneys, or blockages in the blood vessel, affecting your heart, brain, and feet. Early treatment is the best way to keep you healthy. How would you feel about us setting up a monitoring schedule to see how your body responds to some small changes? Patient can reluctantly say you that I see, if it is really that serious, I suppose I don't have much of a choice. And then, doctor, I truly appreciate your cooperation. I am here to support you through this. So this is also one of the important line to show support to the patient, because it's also a mark scaling point. I am here to support you through this, to help you manage this. I would like to recommend some specific lifestyle changes, such as increasing your physical activity, and I refer you to a dietitian and a diabetes educator. They will help tailor a plan that fits your life. What would those changes looks like, patient can ask you. It's a great question. We will focus on a balanced approach, not just cutting things out, but adding habits that help your process insulin better. The dietitian will review your current meal and suggest minor adjustment. Does that sound like a reasonable way to start? Patient, I guess I can try it. And then the doctor's line, that's a positive step. I'll prepare the referral letter now, and we can schedule a follow-up appointment in 2 weeks to see how you are feeling. Is there anything else worrying you today? So this is very important line to say in the end, that is there anything else worrying you today, because there are some tasks which might be you think that you have already discussed, but role play wanted to ask you. So this is very important line to say in the end, that is there anything else worrying you today. So there are three tips I wanted to give you. That always start with an open-ended question by asking what has been on your mind. How would you feel about? So this will encourage more to the role player to give you or to ask you some question and to give more information, to provide you more information. Okay, and explore lifestyle changes, and at least spend 30 seconds to 45 seconds asking about your specific diet or activity habit. This builds the rapport and fills the middle of the conversation. And check for understanding always in between when you are speaking. If you're thinking that you have already speaking, you are already given so much information to the patient, then always ask about the always give these sentences to ask for the understanding, to check for understanding. Does that make sense? How do you feel about that explanation? Is that understandable for you? Is this okay for you? How does that sound to you? So these are the lines to check for understanding. Hope this video will help you in your OET speaking test, and wish you best of luck. Thank you. Bye bye.